everyone, hope you enjoyed the last video. If you didn't see the video, you can go back and watch it. In this video, we will first discuss about the rib. We have 12 pair of ribs, 12 pair of thoracic ribs. The upper 7 ribs are known as true ribs. They are known as true ribs because anteriorly they are connected directly to the sternum through the costal cartilage. The 5 other ribs are known as the false ribs. They are known as false ribs because they don't have direct connection with the sternum. They connected to the 7th rib to the costal cartilage and indirectly connected to the sternum. The last 2 ribs among these 5 ribs are known as the floating ribs, that is the 11th and 12th. It is known as floating ribs because it do not have any connection with the sternum. Now we will talk about a typical rib. A typical rib consists of a head, a neck, a tubercle, an angle, the inner surface, the external surface, and anteriorly it is connected to the costal cartilage through which it is connected to the sternum. The head contains 2 articular surfaces. The smaller surface articulates with the facet on the vertebra above to it, and the larger inferior articulates with its own vertebra. There is a tubercle and an angle. There is also a facet near to the tubercle which is meant for the articulation with the transverse process of the associated vertebra. The superior margin of the rib is smooth and rounded, whereas the inferior margin is sharp. There is a gentle twist at the angle when the rib tries to come towards the forward direction. The inferior margin of the internal surface is marked by distinct costal groove. Now we will discuss about the first rib, that is the rib 1. As you know, the rib 1 do not contain any vertebra, any thoracic vertebra above it, so there will be no articulation for the vertebra above it. So there will be only one articular surface on the head of rib 1. And also it contains the attachment of the scaling muscle. So the posterior surface of this group contains a depression or a roughness for this attachment. There are many joints in the thoracic cavity. As we discussed before, the rib contains 2 articular surfaces on its head. The first articular surface is joined with the vertebra above it. So there is a joint between the rib and the vertebra above it, and the other joint is between the rib and the adjacent vertebra. There is also a joint between the transverse process of the adjacent vertebra and the rib, which is known as the costo-transverse joint. Also, anteriorly there are many joints, that is between the ribs and the sternum, and the rib and the manubrium. As we see in the first rib case, it joins with the manubrium. The joint between the manubrium and the rib 1 is the fibrocartilaginous joint, and mind it, it is not a synovial joint. The joint between the second rib and the sternal angle, it is a synovial joint. The third rib and the sternum, the fourth rib and the sternum, fifth and sternum, sixth and sternum, the seventh rib and the sternum. These joints are the synovial joint. I repeat, second, third, fourth, fifth, sixth, seventh. These ribs form synovial joint with the sternum and the sternal angle. There are also the joints between the 7th and the 8th costal cartilages, and 8th and 9th costal cartilage, 9th and 10th costal cartilage. These are known as the synovial joint. The joint between the manubrium and the sternum is the symphysis, and the joint between the sternum and the scaphoid process is also a symphysis. Now we will talk about the intercostal muscles. The intercostal muscle, that is the muscles between the ribs and between the costal cartilages. These are of two types: the external intercostal muscle and the internal intercostal muscles. Other types of intercostal muscles are subcostales, the transverse thoracic muscles. First, we will talk about the external intercostal muscle. The external intercostal muscle runs obliquely and anterior inferiorly, as you can see in the diagram. That is, it is aligned towards the sternum. Opposite is it for the internal intercostal muscle. The internal intercostal muscles align more away from it, that is, in the opposite direction. The external intercostal muscle helpful in the inspiration, and the internal intercostal muscle is helpful in the expiration. That is, the external intercostal muscle help in pulling the rib outwards, and the internal intercostal muscle helps in pulling the ribs inwards and thus decreasing the size of the thoracic cavity. The innermost intercostal muscles, the subcostales, the transverse thoracic muscles, have same orientation as the internal intercostal muscle. Okay, the subcostales are present more in the lower region of the posterior thoracic walls. These are the type of muscles that passes from one rib to the other rib. Okay, as we see in the external intercostal muscles, these were not passing through the ribs. These are present in between the two ribs. Okay, but in these muscles, the subcostales and the transverses, they pass it through the ribs from one rib to the other rib. In case of transverse thoracic muscles, as you see in the diagram, it mainly passes from one rib to the sternum or the one rib to the xiphoid process. Now we will discuss about the arterial supply of the thorax. The arterial supply of the thorax is mainly by the two main arteries, that are the aorta and the subclavian artery. The aorta moves posteriorly, okay, adjacent, or we can say the anterior to the vertebral column. So it gives branches posteriorly, which are known as the posterior intercostal arteries, which you can appreciate in the diagram. Anteriorly, you can see there is a branch coming from the subclavian artery, which is known as the internal thoracic artery. We have two subclavian arteries, so we have two internal thoracic arteries that runs adjacent to the sternum or the manubrium. There are many branches of arteries that arises from this internal thoracic artery, which is known as anterior intercostal arteries. The anterior intercostal arteries, which arises from the internal thoracic artery anteriorly, moves posteriorly, and the posterior intercostal arteries, which arises from the aorta, moves anteriorly and thus anasmosing with each other. There is another artery which arises superiorly from the costal cervical trunk or the subclavian artery, and it is known as superior thoracic artery. In the diagram, you can also appreciate in the anterior intercostal artery that the internal thoracic artery, that at the level of the sixth rib, it divides into two branches, which are musculophrenic artery and the superior epigastric artery. The superior epigastric artery continues inferiorly and supplies the anterior abdominal wall, and the musculophrenic artery, which passes along the costal margin, goes through the diaphragm and ends near the intercostal space. In this diagram also, you can very well appreciate the aorta moving posteriorly, okay, and there are subclavian arteries moving laterally, and the branches, which are internal thoracic artery, which arises from the first part of the subclavian artery and moves downwards, passing through the sixth rib and giving the two branches, which is known as the superior epigastric artery and the musculophrenic artery. The superior epigastric artery moves downwards, as you can appreciate in the diagram. And there is also one other type of artery which do not arises from the thoracic aorta, but it arises from the abdominal aorta, that is after it passes from the diaphragm, and it is known as the inferior phrenic arteries. It basically supplies the diaphragm arising from the abdominal aorta. We will discuss about the venous supply of the thorax. The venous supply of the thorax is by the many veins, mainly the azygous vein, the hemiazygous vein, the internal thoracic vein, the right superior intercostal vein, the left intercostal vein. All these veins that finally drains into the left and right brachiocephalic vein. As you can very well appreciate in the diagram, anteriorly we have internal thoracic vein, posteriorly we have hemiazygous and azygous vein. All these drain into the brachiocephalic vein. The right superior intercostal vein and the left superior intercostal vein directly drain into the brachiocephalic vein. Now we will discuss about the lymphatic drainage. The lymphatic drainage of the thorax is by the different lymph nodes and the lymphatic vessels. Number 1 is the peristernal lymph nodes. The peristernal lymph nodes are located adjacent to the sternum and the manubrium, and in between the costal cartilages. The peristernal lymph nodes drain into the right brachio-mediastinal trunk through the brachiocephalic nodes. Posteriorly, there is presence of intercostal nodes. The superior intercostal nodes that are present adjacent to the vertebra and in between the ribs drain directly into the bronchomediastinal trunk, that is the right and the left brachiomediastinal trunk. The inferior intercostal nodes drain into the thoracic duct. The thoracic duct then drain into the subclavian trunk, and also the bronchomediastinal trunk also drain into the subclavian trunk or the brachiocephalic trunk. Now we will discuss about the innervation of the thorax. The innervation of the thoracic wall is mainly by the intercostal nerves. As you see in the diagram, there is a presence of spinal cord and also the anterior and the posterior rami. The anterior rami is basically the intercostal nerve. These intercostal nerves are basically the anterior rami of the T1 to T11. As you can see in the diagram, the anterior rami or the intercostal nerve has two branches, one that comes out of the muscle and one that moves forward having a curve and lies between the intercostal muscles. The branch that comes out and lies superficially, it is known as lateral cutaneous branch. The lateral cutaneous branch, as you can see in the diagram, have two branches, one that runs anteriorly, which is the anterior branch, and one that runs posteriorly is the posterior branch. The branch of the intercostal nerve that lies between the intercostal muscle give off a branch which is known as a small collateral branch, and the other main branch moves forward and gives a branch which is known as the lateral branch. The lateral branch and that anterior branch of the lateral cutaneous branch anasmos with each other. There is also another branch, that is the anterior cutaneous branch, that has a branch which is known as the medial branch that supplies the sternum. These intercostal nerves carry the innervation to all the muscles, that is the intercostal muscle, the subcostal muscle, the transverse thoracic muscle that we discussed before. It also carries innervation to the superficial structures, that is the skin and the parietal pleura. Also, it has postganglionic sympathetic fibers to the periphery. Other than supplying to the thorax, it also supplies to the brachial plexus, especially the anterior rami of T1 contributes to the brachial plexus. The lateral cutaneous branch of the second intercostal nerve contributes to the cutaneous innervation of the medial surface of the upper arm. The lower intercostal nerve supplies muscle, skin, and the peritoneum of the abdominal wall. So, besides supplying the thorax, the intercostal nerve also supplies some part of the abdomen, the arm, and the brachial plexus. Now we will discuss about the lungs. As we all know that we have two lungs, and the lungs are the main organ for respiration. The two lungs are separated by the mediastinum. The air enters and leaves the lung via main bronchi, which are branches of the trachea. The right lung is normally little larger than the left lung. The reason is that the left lung, there's a presence of heart. So, the right lung is always larger than the left lung. Each lung has a half cone shape with a base, apex, two surfaces and three borders. The base of the lung sits on the diaphragm. The apex projects above the rib one and into the root of the neck. The two surfaces, that is, the costal surfaces, which lie adjacent to the ribs and the intercostal spaces. The mediastinal surface that lie against the mediastinum anteriorly and the vertebral column posteriorly. And there is a small common-shaped hilum. We have three borders: the inferior border, the anterior border, and the posterior border. As we discussed before, the difference between the root and the hilum. So, it is very important to know the structures that pass within each root and located in the hilum. And these structures are mainly that passes from the trachea or from the mediastinum into the lungs. And these are pulmonary artery. There are two pulmonary veins. There is a main bronchus that enters both the lung, bronchial vessels, nerves and lymphatics. Now we will discuss about the right lung. The right lung has three lobes and two fissures. The name of two fissures are the oblique fissure and the horizontal fissure. The oblique fissure separates the inferior lobe or the lower lobe from the superior lobe and the middle lobe of the right lung. The horizontal fissure separates the superior lobe and the middle lobe. As you can see in the diagram showing the right lung, the medial surface of the right lung, you can very well appreciate the oblique fissure, the horizontal fissure, the superior lobe, the middle lobe and the inferior lobe. You can also appreciate the entry of the superior vena cava, the inferior vena cava, and there is a presence of esophagus. Between these two structures there is a hilum, and in the hilum you can very well see the presence of bronchus. Okay, there is a presence of pulmonary artery, the pulmonary veins, there are some parts of heart too. That's all for today. Rest all will be discontinued in the next video. I hope it would have helped you understanding some topics. If you like my motive behind it and my video, please like it, subscribe it and press the bell icon. Don't forget to share it. Thank you.